Good morning, everyone. We are coming on the air right now as we await a news conference in Parchment where residents have been warned not to drink the water.
The drinking ban impacts 3,000 people. That's the entire city of Parchment, and some residents in Cooper Township who are connected to Parchment's system. State officials received test results yesterday showing high levels of PFAS in the municipal water system. This has suddenly become the worst outbreak of the likely carcinogen in West Michigan.
If you live in the danger zone, you can get free bottled water at Parchment High School. That giveaway will continue until 8 o'clock tonight.
Right now, let's go live to Parchment High School, where officials are going to give us an update on the situation.
Special thank you to the volunteers and the professionals. This is a community that knows how to work together. It knows how to deal with and plan for and execute emergency plans. And so I couldn't be more proud of the way people have already come together and the quickness in this response. One thing I want to point out is that we're here today because of a proactive surveillance effort. Right? This is something that was discovered because Michigan is the first and the only state in the nation to test small water systems for PFAS. We set up an effort, a process to do so many months ago. We're about halfway through the state, and in this case, when the results came back high, people have gone into action very quickly. Now, there are several aspects of moving on from here, and while we are moving as expeditiously as possible, we have to make sure that everything is done correctly also. So everything from how to flush and discharge the water from the current system to how to hook up to a new system and ensure that the new system works well with the old infrastructure. All of those things, there are a team of professionals working together to make it happen. And so again, if I could say thank you to everybody who's come together to make all of this work come to fruition so quickly. A huge thank you, including or especially the volunteers and the football team that's passing out water today. And so with that, I'll turn it over to Mayor Bridigan.
Thank you, Brian. Hi, everybody. I just briefly want to mention that this has been an incredible collaborative effort by a lot of people. Our state of Michigan, we've got Fred Upton here. We've got the county involved. We've got, of course, our city folks, the Parchment football team that's been handing out water here for, gosh, since 6:30 this morning. And I'm just amazed at how this community has come together. And it takes a village. And we are that village, and I want our residents, our citizens to know that we're going to get to the bottom of this, that right now we are on top of it. Again, we'll be distributing bottled water as long as is necessary until the water gets back to a safe condition. I will turn it over to Jim Rutherford, who's the Director of the Health Department of Kalamazoo County, to go over some particulars. Jim.
Thank you, Mayor. I want to echo the sentiment. I want to thank the City of Parchment, Cooper Township, and all of the state and local responders to this incident. I've just got a couple of comments. The Emergency Operations Center has been activated, and that began yesterday at about 5 p.m. We've been working yesterday to address PFAS levels found within the City of Parchment water supply. We'll have an update on the short-term solution, and I've got a group of individuals that we're gonna go through, and each of them will give updates relative to their respective areas of concern. We know that there's a lot of questions and concerns, and in addition to this, we'll have obviously subsequent media opportunities. We are planning on a town hall meeting Tuesday, this upcoming Tuesday, most likely at this venue here at the high school. We're working on the specifics of that. Ideally, we'd like to start that at around 5 p.m. on Tuesday. We'll have an open house from 5 to 6, and then we'll have the actual town hall meeting from 6 to 8 o'clock. It's really important, and the state's been through a lot of these town hall activities over the course of the last year. It's important that we are here for the residents of both Cooper Township and the City of Parchment. We want to make sure that they are on the top of our list. Their health is our primary concern at this point in time. We won't have all the answers. I can guarantee that we won't have all the answers for you because there's a lot of unknowns as it relates to this particular contamination, but also as it relates to PFAS in general. I do want to indicate that we have updated the contact information, and we have a county line now. That call-in phone number is 269-373-5655. 5346, and we've got about 10 lines that are open, and we've got about a half dozen public health workers that are there to answer your questions. So next I'm going to turn it over to Jim Baker. Jim is the utility director with the city of Kalamazoo. Jim's going to give us a little bit of information about the work that they're doing. We're very fortunate to have the fact that Kalamazoo and this municipality are contiguous with one another, so we have a short-term plan that could eventually evolve into a long-term solution for this particular situation. So with that, I'm going to turn it over to Mr. Baker.
Yeah, thank you, everybody. The City of Kalamazoo began working last night on an emergency operation plan to connect the City of Kalamazoo drinking water system to City of Parchment. And that plan is an interim plan. That plan is designed to provide flushing of the contaminations that are currently in City of Parchment. The water system as it stands today in Parchment is not safe to drink, and that's why we have the bottled water. The solution that we are implementing at this time really is that saline that washes out that wound. There may be an ultimate solution that could involve City of Kalamazoo water connected to City of Parchment. However, at this time, we're just using this water to flush out and help clean the City of Parchment's water system. With that, I'll turn it back to Jim. Thank you.
And I know that you'll have a lot of questions and answers, and we'll deal with those at the end. Next, I want to introduce Mark Ducharme. Mark is a DEQ supervisor that's going to talk a little bit about the water sampling, as well as beyond the 3 wells that were contaminated or that were assumed to contaminated the municipal supplies. We also have some concerns as it relates to residential wells, so I'm going to have Mark elaborate upon that.
Thank you, Jim. Yeah, the questions that have come up with residential wells, what we're doing right now is we're working with the local health department and the rest of our partners. We're trying to understand which wells are present within a 1-mile radius around the impacted municipal wells. At this point in time, we're not saying we're going to sample all of those wells, but what we're trying to do is we're trying to develop a well-crafted, well-thought-out, expedited and swift action to be able to go out and sample the wells that we believe there may be some concern. So we are working on that plan right now. We hope to have a plan later today to be able to do so. The other thing we're also trying to figure out at this point in time is we want to know where PFAS compounds may have been made or used in the area. So we have a couple of locations that we're looking at right now, and we're also trying to put together a plan to go out and do some sampling of monitoring wells that are in place nearby some of those facilities. So again, we're trying to take a systematic, well thought out, quick approach to be able to understand where the PFAS may be sourced and what may be at impact so that we can protect the health of the citizens.
Thank you, Mark. We know that there's a lot of health-related questions, so we have a couple of individuals that will begin to have that conversation with you. First, we're going to hear from Dr. Will Nettleton, who is the medical director with the Kalamazoo County Health and Community Services Department.
Thank you, Jim. I thought I would just take several minutes to describe the role of Kalamazoo County Health and Community Services and also to provide additional context for the information you are receiving today. So first and foremost, Kalamazoo County Health and Community Services is here to protect the health of the public. Second, we act as a liaison between our community and our state partners, such as the Michigan Department of Health and Human Services and the Michigan Department of Environmental Quality, in addition to our local municipalities, such as the City of Parchment. Third, we provide and interpret health hazards and health risks in our community. What are the health risks in the community? We help interpret and communicate those risks to our community. And fourth, we assist in the assessment and provide intervention for those potential health hazards in our community. I think it'd be helpful to provide the worldview of a scientist, of a toxicologist, or an epidemiologist, and how it applies to this situation. In a nutshell, we seek to understand the relationship between an exposure such as a chemical like PFAS, and an outcome, a disease or a health-related event. And that's really complicated. There are many factors that go into that relationship. And to better understand that, scientists perform studies in both animals and in humans that ask different questions. All of that information goes into an overall risk assessment that's presented at the federal level, the state level, and then it's implemented locally here in our community. The science surrounding PFAS is emerging, it's evolving. And given that fact, our recommendations and our interventions will evolve as well. And I think it's important to acknowledge the uncertainty that goes along with PFAS in this public health event. Uncertainty often goes along with potential health hazards in our community, and that can be really unnerving. So for example, the fact that a potential exposure may have occurred to a chemical like PFAS does not necessarily mean a health outcome or disease has developed or will develop in a person who is exposed to PFAS. And that statement I just said is really unnerving. And we at Kalamazoo County Health and Community Services are going to walk with you. We're going to walk with you as our community, as the public, and in partnership with everyone you see here today. And we commit to providing further assessment and intervention for this potential health threat to our community. I'd be happy to answer more questions regarding specific health-related questions in partnership with our Michigan Department of Health and Human Services toxicologists.
Thank you, Dr. Nettleton. And next, I'm going to have Corey Gorsch, who's the he's an environmental health director with the Michigan Department of Health and Human Services, talk a little bit about the state's involvement.
Thank you, Jim. So I'm with the Michigan Department of Health and Human Services. As Jim stated, our role is being guided by MPART, the Michigan PFAS response team. We've been working on these sort of collaborations between the DEQ, local public health, and state public health to respond to a number of situations around the state. We have I'll just say a standard process. There are processes in place, and I'd be happy to discuss those in detail. But what Dr. Nettleton just described, I would support everything he just said. This will take some time, and we will be back numerous times in partnership with all of those around us to respond to the citizens' concerns going forward. Thank you.
Thank you, Corey. And finally, I'm going to have Sheriff Fuller come and talk a little bit about the continued effort as it relates to water distribution.
Thank you, Jim. So throughout the morning, again, we were starting at 6:30 to hand out water. People were lined up. Throughout the day, we've had lines of cars, and it's been a very positive response, and we really appreciate the cooperation of all the citizens. Not only citizens, but volunteers. We've had people show up and want to volunteer just to hand out water. We've even had people call and say, can I bring water to give? We really appreciate that, but what I want everybody to understand is we've got water. We have a lot of water right now, and we have some stores in the background that if we needed them, they're available. So thank you for the offers of donations, but we're all set. As of about an hour ago, we'd handed out over 3,000 cases of water to residents that have showed up here today and asked for assistance. You heard the mayor mention the high school football team. The Parchment high school football team got out of having to do ladders and sprints and all kinds of things like that today, and tackle drills, because they're taking care of citizens. That's part of Team Kalamazoo. That's what you're looking at here today. All of this group back here, all of those young people over there, everybody that's coming in here taking care of people, this is Team Kalamazoo. So again, that's why we're confident that things are being taken care of and that we're here for the long haul. We will take care of people. Water is also being delivered to shut-ins. So the number that was given a little while ago by Jim Rutherford, if you know of somebody that is a shut-in, please contact us and we will get water to them. Today we've had the state police, the Michigan State Police, helping us with the deliveries. The sheriff's office is helping with deliveries. The senior services of Southwest Michigan came here and picked up water to take to people that are shut-ins that they know of. And so we've got a lot of partners in Team Kalamazoo, Salvation Army, the American Red Cross. There are a lot of people here taking care of people. We're trying to answer questions also. We're going door to door right now. Our state senator was part of a team this morning going door to door, Margaret O'Brien, going door to door, helping residents understand what's going on in their community, handing out flyers. We've handed out over 1,500 flyers here at this location alone. A lot of these things wouldn't be possible without Team Kalamazoo and how everybody steps up. We've seen some of these things in the past, we're seeing it again. Some of the questions we're hearing, if a private well is eligible for water. Yes, if you show up here and say you're going to want water, we're going to give you 2 cases today, and there are more cases coming that if there's a need for this. Another question is, when will we know about the testing of private wells? The DEQ is working on a plan for that. More information will follow, but that is part of the conversations, and that's going to be a large part of what people have to hear is that these planning procedures are active. Since 5 o'clock yesterday afternoon, many of these people standing here with me or behind me, or these volunteers out here, have gotten very little sleep because they're here to take care of citizens. And the last thing that I'll mention is that people are asking if they can buy a kit to have their private well tested themselves. Right now, that's not being recommended only because we want to make sure that you're getting the test results that are going to be qualified. A private test might show negative, or actually false positives. And so we want to make sure that people are not panicking when they have results. All right, that's all I have for you right now, and I'm going to turn it back over to Jim.
Thank you, Sheriff, and I want to echo his sentiment. I couldn't be prouder of this community, of Parchment, of the township, of the state's response, of the city of Kalamazoo's response, of all of our partners within the DEQ and the state health department. This is how I think a functional process works. So with that, we're going to open it up to questions and answers. We've got a group of experts here, as well as their phone a friend over there in the wings, just in case they don't have the answer. So we'll go ahead and open it up for questions.
How long have the residents been drinking the contaminated water?
I'm going to turn that over to Corey.
Do you want to say, or do you want me to go? Okay, sure. So that's a very good question. I think right now it's going to be based on getting additional data to understand the source. So the Department of Environmental Quality is going to go out and try to find where did this come from. And with that sort of knowledge and some additional data, we can start to answer that question, like how long has this been there? Until we have greater data, you know, we're today just focused on making sure everybody gets on bottled water and ends exposure now. And that will be a very important question in trying to understand next steps.
Next question.
We've heard from some residents today who said that they've seen the water being flushed into rivers and creeks like the Kalamazoo River. Why is that okay?
We do know that we need to drain the existing system. We're working in unison with the state, the DEQ. The processing of that is considered a contaminant. We don't have a complete answer for that. I think I'm going to have Jim Baker talk a little bit more in depth about what that's going to involve. Again, this is a work in progress. Go ahead, Jim.
Yeah, that's a great question, and you know, certainly we're working to address that. There was a limited amount of flushing that occurred last night initially to get the two systems connected together. We've got to bleed air out of the systems. We got to make sure that from an engineering perspective, we're not breaking pipes and we're not causing further damage. So there was some amount of discharge last night into the storm and sanitary sewers. The amount of discharge that went into the sanitary sewers is being treated at the wastewater treatment plant. We're working right now cooperatively with our own technical team and City of Parchment's team to put in place some storm intercept or bypass pumping that will allow us to further engage on a complete flushing plan yet tonight. So there was a little bit of flushing last night. There's, you know, trucks running, you know, fire engines running up there, and you're starting to see some of that water move in. That's going to become more intense as we move through the evening, and that more intensive flushing as we move through tonight and tomorrow. We're going to make a concerted effort to try to get some treatment to that water. Thank you.
Jim, while you're up there, tell us what your tank is.
The time, it's really too early to tell. You know, this is really a moving target. The city of Kalamazoo's role in this point right now, as I said earlier, we're the saline solution that washes that wound. We've got to get these contaminants out, so we're working to do that. Once we get the contaminants out, we need to hold system pressure, and then there's a whole bunch of testing that has to be done. This is considered a new source, so anytime a drinking water switches sources, there's a lot of concerns and a lot of testing that has to be done. So just because you see the city of Kalamazoo trucks hooked up and you see water moving and you see the flushing, the city of Kalamazoo water in Parchment system at this time is not safe to drink. I don't have that answer for you at this time.
Rain.
If weeks, several weeks, and a lot of that's based on the type of testing we're doing. That all has to be sent out to analytical labs, and we're going to do our best job to turn those samples around. There's a lot of chemistry that has to be done. There's a lot of approvals and a lot of things that have to happen. We don't know right now if City Kalamazoo water is the solution. There could be a different solution, so we're still working that out.
Has the City of Kalamazoo water been tested yet?
The City of Kalamazoo, so first off, City of Kalamazoo as a water system serves more than 100,000 people. So we're putting a different set of criteria for testing in that we've routinely been tested for PFAS. Our last round of sampling for PFAS, PFOA in the drinking water system, we had non-detect levels well below the advisory level. City of Parchment, they serve below 10,000 people. They've never had a history of being tested. Thanks in part to the DEQ and the governor's initiative to test all municipal water systems, including those under 10,000. That's how this was discovered. So we had a system that had no history of being tested, and thanks in part to those initiatives set in place by the governor, we now have those test results back.
Is there any way the DEQ could share those test results with the public?
I'll turn that over to the DEQ.
Well, before you go, why was Parchment not tested, considering the industrial nature of the city?
That would be a regulatory question. I think it's better handled by the DEQ. Thank you.
Well, if I could just mention standing up the testing requirements for all water systems. That was exactly the question that we had asked earlier. Across the entire nation, not just in Michigan, across the entire nation, the rule is that these tests for small water systems are different than larger water systems. And we couldn't find a good enough answer for why that was the case. And that's why Michigan decided to be the first in the nation to require testing of smaller water systems. My understanding is there are about 1,800 systems that need to be tested, and since we started, we're about halfway through those. This is the first one that came out at a level above the action, the state action level. The other thing I want to point out is that even to this day, on this day that we are talking, there is not a federal action level for PFAS. There's a guideline, there's a recommendation. The state, through our regulatory process, decided to establish an action level of 70 parts per billion, but really we look at 30 parts per billion as the place where we, or I'm sorry, per trillion, at the point where we move into action. And so Michigan is at a point where the deficiencies of literally the rest of the nation in testing we're demonstrating why it is so important that these rules, particularly for drinking water, change across the country. And the people behind me here really are pioneers in a sense that in showing why it is important. These rules that have been in place for a long time need to be reviewed, updated, and made such that they protect all citizens.
Next question.
Could someone put in perspective the 20 times the normal or acceptable limit? I mean, I guess for people who live here, that's scary to hear. I mean, how that just seems.
I'm going to have Corey from the state address that.
Absolutely. So you're in reference to the EPA's lifetime health advisory number being 20 times above that. That is why we're here. That obviously is a concern. But to give you a little understanding about what does that 70 part per trillion represent? It represents a level that when you're below which there's really minimal concern about this chemical. Now, I'll caveat that with there's a lot of emerging science going on, and we're currently reviewing some new information from the CDC's Agency for Toxic Substances and Disease Registry. But in either case, when you look at that 70, there is basically a 30 to 300-fold safety factor built into that. And it's built into it based on, obviously these are hazardous chemicals. You test them on animals to find out what goes on. And so when they tested them on animals, they said, let's take the most sensitive endpoint, and it ends up being in the babies of the rats. And they say, you know, there's some subtle developmental changes that go on in the bone structure. And then you take that number and you divide it by 30 and 300, and it becomes a very low number, like 70 parts per trillion. And that's the point where public health and DEQ and the rest of us take action in the attempt to do this in a very proactive and aggressive way early on. So, yes, the 1410 is very concerning, and it's going to take time to understand what that means. But it is also still within, you know, a range where we, as Dr. Nettleton clearly, I think, articulated best, that no one at this point is saying anyone is absolutely would be harmed by this. It's just that we need to think about that, investigate that, collect data, and work together going forward for an extended period of time to be able to answer that question for the public very clearly. Thank you.
Lieutenant Governor, given that this is the first small water system that's been tested, are there concerns that this is something we could see all over the state in smaller communities?
It is not the first water system to be tested. It's the first one that came back with a high result. About half of the systems across the state have been tested with the initiative that was put into place, I believe, late last year. But the reason that we did that is because we are concerned, and we're not just concerned for Michigan. We know that around airports and defense sites that there have been or could be issues, different types of industrial activities, depending on in things that may have happened in the 50s or in the 60s or even earlier than that. These are the sorts of things that are being investigated, and the work that is being done now to literally develop the science is really important, because this isn't even a chemical that has an action level. According to the rules, aside from Michigan specific regulations, a result like this coming back at the level that we're talking about, it technically doesn't require action. And we think that that's wrong. That's why we put our own rules in place here in Michigan. But we want Michigan to be an example and to set a standard here for the rest of the nation. And we do hope that everybody pays attention to this.
Of the 1,800 systems that need to be tested, is there any way that we can get our hands on that data so we can get a better understanding of our water, where we come from?
Yes. Yes. Right.
And again, someone from the DEQ was supposed to answer the question about with Parchment's industrial past, why it wasn't tested earlier at this time.
I think probably the best answer I can give you is I think the Lieutenant Governor did a very nice job of explaining MPART and the initiative that was done to test the waters across the state and the municipal systems. There are a number of sources that potentially could exist where PFAS are made or used. Some of those are airports where AFFF foam, which is an aqueous film-forming foam that was used for firefighting. PFAS can be present in that. It can also be in materials such as like Scotch Guard, which is used to protect fabric, and oil-proof papers. So the paper industry, the plating industry can also be a source where they used it for mist suppression. So there are a lot of locations where it could be sourced, but it's just a situation where, as the Lieutenant Governor portrayed, is that MPART, the governor's initiative, it was carefully designed to be able to go out and take a proactive approach to understand the safety of the municipal water supplies around the state of Michigan. And so that was done in a very deliberate, well planned out, crafted approach. And this is the first one that we've identified where we had high levels of PFAS above the standard.
Any other final questions? Okay, just a reminder that that call-in number now is 269-373-5346. And then again, we anticipate, and there'll be more information that will be coming forth relative to the town hall meeting. Again, that is preliminarily scheduled for Tuesday, this upcoming Tuesday, here at the high school. Open house would be from 5 to 6, and then the actual town hall meeting would be from 6 to 8 o'clock. Again, we appreciate all of the help of the residents and all of the support that is behind me, and we'll keep you posted as we progress through this work. Thank you.